Hi, everybody. Welcome to the podcast Redesigning Normal. I'm your host, Andrew Southern, and I'm here with our guest, Vivek Taparia, who's the VP at Optum Tri-State. Good morning.
Good morning. Nice to meet you, Andrew.
Nice to meet you. Thank you for joining me on this podcast. Vivek, could you tell us a little bit about yourself and about how you got into your role at Optum?
Yeah, absolutely, Andrew. I guess I'll start off from the beginning. I'm from the Midwest. I grew up filing charts in my mom's office. She's a family physician, and I always was interested in making impact in my career. My parents are immigrants from India, so I'd always go visit family in India and see a lot of disparity in wealth between countries, and wanted to figure out what I could do in my career to make a difference. I ended up studying development economics in college at U Chicago, and afterwards spent some time doing economic development work, both in Mexico City out of Fulbright grant, and then in India doing microfinance work. But I was also able to get some good experience working on Wall Street for a couple years at JP Morgan before going to Harvard Business School. And while in business school, I knew I wanted to do something healthcare related because of my longstanding exposure to this sector. So started off out of business school doing operations work, setting up ambulatory surgical centers. So basically, these are places where people can get surgery outside the hospital in a low-cost, high-quality setting that has great clinical outcomes. So I was setting those up and running them around the country, wearing hard hats and scrubs and being in operating rooms, and had the opportunity to work with a big health system out in Long Island, and moved out here to help them set up ambulatory surgical facilities. That's how I ended up out on the East Coast. My wife actually is from Long Island, so it worked out pretty well. And after being in the ambulatory surgery center industry for several years, I had a startup itch, and an itch that I wanted to scratch. So I ended up joining a technology company called Quartet Health on their founding team, and I helped them raise an investment from Google Ventures. I was their acting CFO. It was a very exciting time. I was helping them as they scaled from 20 to 70 people, and as they grew out of their startup space to a long-term lease. It was quite an exciting experience. I then joined my old client, the Catholic Health System in Long Island, helping them develop population health infrastructure. So basically setting up the systems to focus on prevention, keeping people healthy, keeping people essentially well, so you don't have to be hospitalized, so you can avoid ED visits, and working with the health plans and the provider systems to focus on what they call value-based care, which is basically population health. And then I decided to ultimately join Optum Tri-State. OptumCare is basically the medical care delivery division of United Health, which is the large insurer, the multi-billion-dollar insurer, and we basically consist of medical groups around the country. Mm-hmm. And in the Northeast, Optum Tri-State consists of 3 different medical groups. One is ProHealth in Long Island. We have Riverside Medical Group in New Jersey, and we also have Caramount, which is in Westchester. So we have over 2,000 doctors. We also treat over 1.2 million patients a year. And in my role here at Optum Tri-State, I oversee 60 urgent care centers in 3 different states, 5 ambulatory surgical facilities, and then also virtual care initiatives. So it's been quite an exciting experience and ride. And it's been really rewarding expanding access to testing and vaccinations during the pandemic. So that's sort of my background and how I got to my current role.
Wow. Okay. That amazing story. When did you, in that story, when did you kind of get into healthcare? Like how many years ago was that?
I think I would say it was starting off filing charts in my mother's office.
right.
It's always been exposed.
Sure. Okay.
Then while in business school, I did an internship at Johnson and Johnson in one of their divisions doing medical devices, and that's when I was really working with surgeons and being in operating rooms, and I got truly exposed to the delivery side of healthcare. And that's kind of because healthcare consists of different segments, and broadly speaking, it's payers, which is insurers, providers, which is hospital systems, and those that deliver care. That it's pharmaceutical companies and medical device companies. Those are broad pillars. Obviously, there's more different subsectors, and then I got very exposed and interested in the provider side of healthcare, just through my own personal experiences and internship experiences.
So now, in your current role as VP, what are you doing every day? Is it managing the whole pie, or are you still into facilities build outs and that kind of thing?
Yeah, absolutely. So I'm a VP of operations. And essentially I would call them a general management role. So you're overseeing the day-to-day growth and delivery of care in the business. So not only are we growing, we actually over the past year we grew from 27 facilities to 60 facilities just through different acquisitions and opening new facilities, et cetera, to meet the needs during the pandemic. We launched a new division called Let's Get Back, which is doing testing for major movie studios and productions and the major streaming companies that we all know of. We provide a lot of services for them. A big part of my role is essentially making sure we meet our consumer needs and that the trains are flowing smoothly. But I would say it's being a coach to a great team and making sure the right people are the right roles. That's I would say the most important part of my role.
Incredible. Okay, I think I've got a good sense of it. So let's rewind to late February 2020.
Sure.
At what point are you made aware, either from your own research or from discussions within your company, of this potential pandemic that may come to the U.S.? Like, when did this become something important for your business?
Oh, yes. Interestingly, I actually joined Optum Tri-State during the pandemic.
Okay.
This was last summer. However, I was with the Catholic health system during that time, and I remember having meetings with the ED service line, and just we're all reading about what is COVID-19 and coronavirus. What is this? And we were having internal meetings trying to figure out, is this something that we need? Do we treat this like the flu? Do we just wash our hands and to stay calm, or is it something that is going to have major repercussions? And we were paying close attention to what's happening in Italy, and I would say within a week everything changed. The school started to close, and it just everything shut down pretty quickly. So for me, everyone's job changed in the health system, and my job all of a sudden changed from a lot of the business development and partnerships and population health work I was doing to literally helping deploy telehealth infrastructure to go out in the field and work with physician groups and help them set up the best workflows and practices to set up telehealth pretty quickly. So that's kind of what I ended up doing at the inflection point of when everything shut down.
Okay, and then as the pandemic continued, you actually moved from one job to another job.
Yeah, absolutely. So I think what was happening is that a lot of health systems got impacted, and unfortunately during the pandemic, the health systems that got impacted most were the ones that needed to. They got impacted financially. The way the healthcare reimbursement system works is that you're reimbursed for doing procedures, for operating on folks, and those are some of the high-paying revenue-generating sources for health systems. So many health systems either had to redeploy their workforces, like I did. I started setting up telehealth infrastructure, et cetera, or working from home, and I realized that I could make a lot of impact. I wanted to be on the front lines and roll up my sleeves, and the opportunity at Optum to to run an urgent care network across the tri-state was something that I felt was a calling for me, and leveraging my background and skill sets to make an impact during this trying time for society. So I decided to make that move during the peak of the pandemic, and it's been truly one of the most rewarding and trying experiences of my career and life, as we tested and vaccinated over 500,000 people over the past year, and we're
Wow.
seeing our daily urgent care volumes and testing volumes grow by 3 times what they were pre-pandemic levels. So that's sort of my journey into my role and what happened during the transition.
So actually, I'll go into it a little bit more because you come into a business as the VP of operations during a pandemic. What was Optum already doing, maybe across the entire portfolio of clinics? Had they adjusted? I mean, I'm sure they had their facilities, their procedures in order to sort of manage the current pandemic. For instance, I've spoken to some other folks, and they would stagger the staff, in different phases, or they would add technology like fever detection or air filtration to the facility. Was that already there, or did you do that?
I would say there's numerous different strategies that we deployed to keep people healthy and safe. I think number one was deploying telehealth pretty rapidly throughout the company. At one point, north of 50% of all our visits were telehealth related, and social distancing and temperature checks and masking. Those were all pretty important. I think we felt that being on the front lines, whether we're administration or not, being in person was critical to move quickly and set up a command center. So we tried coming in as much as possible, putting in place all the safeguards in place. But we needed to do that to just foster the teamwork and launch all of what we had to do. In addition to telehealth, we set up infrastructure that enabled quick access to testing, so drive-through urgent care settings. So consumers wanted to get tested, but in a safe way. And we borrowed from the restaurant retail industry and set up drive-throughs for COVID testing. So just like you go to McDonald's to go through a drive-through, we would actually set something up where you can drive up and get COVID tested from the car. So we were some of the first organizations to do PCR testing through the drive-throughs and rapid tests through the drive-throughs. I did get a lot of angry calls from landlords because the parking lots were all clogged, but I think people were generally understanding that this is something we needed to do to flatten the curve. So those were some of the techniques we did that were necessary to flatten the curve and keep people healthy and safe.
From just a straight business perspective, there is some payment that comes for testing and for vaccines, I imagine. It's coming from somewhere. So, right, you guys are getting your money back somehow.
Yeah, I would say, that absolutely. So I would say on the healthcare business got impacted in different ways. So a lot of people stopped having surgery. So, for example, I also run the ambulatory surgery centers. We shut down those entirely unless they were incredibly required non-elective procedures. And then all types of office visits went down, particularly certain specialties. Pediatrics has been impacted meaningfully. And then certain parts of the business had pickups in demand, including the testing business. So it all kind of has that levels of cyclicality. So that's kind of how that works.
Yeah, that's kind of what I was getting at. Was I could understand if you couldn't do elective surgeries anymore, but maybe the just sheer volume of testing, can help make up that bottom line. Although I imagine that there's a whole different staffing requirement for that kind of thing.
Yeah, absolutely. Staffing is one of the biggest challenges, particularly all of a sudden over the course of just a few months when your demand goes up 3 times. How do you recruit and retain folks, particularly when people are testing positive and are on the front lines? And how do you manage those positives? Physicians, front office staff, medical assistants. I think people felt a great calling to serve. During the peaks of the pandemic, a lot of our offices, our company decided to redeploy staff from the offices to the urgent cares, whether they be front office staff, medical assistants, or even physicians, whether you're a urologist or an anesthesiologist, just being deployed in the urgent cares to kind of help alleviate the needs and provider shortages. We did all of that. So just to manage the staffing needs and requirements, it was quite a trying and turbulent time, but rewarding at the same time. And I think a lot of people felt that this was a true calling.
Amazing. I mean, we've all watched the medical profession step up big time to the past year and a half and give tirelessly, their skills to help people. I mean, I've touched up against it. I never got COVID, but certainly had to go get testing, and you got the vaccine and all these things. And I see people going to work every day. My mom's a nurse, and so she's part of the effort to distribute vaccines in New Jersey, and she saw it very much as her calling as well.
Absolutely.
So I was going to ask you a little bit about telehealth, actually. That, I imagine, is something that was advanced probably quicker than maybe was on schedule because of the pandemic. Was that a fair thing to say?
Yeah, absolutely. I think if you talk to any provider organization across the country, they're going to say something similar, in that their telehealth visits went from less than 1% of visits to over 50% of visits within the course of 2 weeks. So it's almost a very common story now. But I think going forward, paradigms have completely changed. It's now, I feel, the standard of care. I've talked to some surgeons who say that they do telehealth visits with patients. Let's say a patient was far away, let's say 50 miles away. They might just do a telehealth visit with a urologist and then get their imaging done. And then the urologist, the first time I meet them to take care of a kidney stone, the first time they physically meet is when they have surgery. And those are the type of things that create access and save people time and just promote better health care. So I think there's paradigms of care that are truly going to be here to stay. We're already deploying. Not just, telehealth goes beyond just video visits. It goes to virtual care. How can you leverage technologies like remote monitoring, remote stethoscopes or otoscopes where you can look into the ear? So we're already working with certain summer camps that are interested in using technology where you could have telehealth and a doctor, if kids are at a summer camp away for the summer, can a doctor remote in if a kid gets sick and hears somebody's heartbeat, hears somebody look into the ear and make appropriate diagnosis. And those technologies are now here to stay and have definitely accelerated over the past year.
So that would be whatever platform you guys use, maybe you have your own for telehealth, is able to, you can add on peripherals that, like the ear, to look in the ear or to take the temperature or whatever.
Absolutely. I would say those are in nascent stages, but that's all going to be more increasingly the paradigms of care going forward.
Got it. So do you expect telehealth to sort of maintain its current piece of the pie in the practice, or do you think that once people can go, or now maybe it's starting, come back to the clinics, that they'll prefer to see their doctors in person? Do you see that data yet?
Yeah, so it's interesting. Yes, I think that the percentage of visits that are in person are now increasing, and the percentage of telehealth visits are decreasing. And part of it is you sometimes you just need to be seen in person to check different vitals, et cetera. But I do I have a lot of just friends and colleagues who are physicians, and they say their patients are telling them when they do telehealth visits, the patients tell them, why was I doing this in person before?
Right.
And I think consumer preferences have changed, and I also think that it might be generational as new generations come of age. The preferences are going to be different. We're the swipe to the right sort of culture, and folks are in. Like, how often do you really go to the bank for routine transactions anymore? It's
Right.
you don't say I'm going to do e-bank. You just say I'm just going to deposit my check through my phone, and I think the paradigm of care is it might be I think that analogy will apply to care delivery with respect to telehealth.
Sure. That makes sense. I mean, there's certainly, as you described before, if I had some symptom, I went to the doctor, we spoke about it for 20 minutes. They said, we need you to go get an image. So then I go down to a lab and I get the image. It's sent to the doctor. The doctor reads it. Sometimes they would call you. Sometimes they would have you come in to sort of read it with you. A lot of the first visit and the second visit could just be done remotely. I just have to go to the lab.
I'd agree.
Then, right.
And even after your surgical care, the post surgical visit could be done by telehealth too, or any sort of lab result follow-up could be done by telehealth. So there's so many different components of the whole episode of care that could be protocolized for telehealth. It's quite interesting.
So that saves everybody time and money. Everybody on both sides of the equation are saving time and money, maybe at the expense of a bedside manner. I'm sure there is certain things that are exchanged in person that are important for medicine, but if for the right kind of appointment, it's probably fine.
Oh, absolutely. I think clinicians are very prudent to understand this is appropriate to be delivered through telehealth versus this really needs to happen in person. It varies by specialty as well.
Sure.
So for certain specialties lend themselves much better to telehealth. Psychiatry, behavioral health, oftentimes those lend themselves better. Dermatology, perhaps, versus orthopedics. The surgeon often wants to be able to touch your joint or your arm. So it really depends on the part of the episode of care and what's the appropriate clinical protocol to not sacrifice outcomes, but to improve just value for all stakeholders.
Got it. So what's the vibe in your business at the moment? We're recording this sort of mid to late May. What is the current state of play as it relates to the pandemic, hopefully receding, and it seems that data says that right now, and the business in general? Where are you guys headed?
Yeah, it's a great question. We are now in the mode of post-pandemic planning, and we're thinking about how do we staff the organization appropriately, whether it's the urgent cares or the clinics. How do we think about that? How do we think about our virtual care strategy going forward, and what are the skill sets people need to have? The technology skill sets. Do we need dedicated virtual care teams? Do we need cross-trained in-person virtual care teams? Those are all conversations that we're thinking about and having increasingly. We are constantly doing provider education on the ongoing guidance and regulations because they continuously change, and it's provider education with respect to vaccinations and appropriate protocols, but it goes beyond clinical education. It's all the regulatory environment is constantly changing with respect to the state of emergency and waived copays and telehealth payment parity laws and provider cross-state waiver laws. A lot of things are just the guidance is evolving. Do you need to be tested before having surgery? Are you partially vaccinated? Are you fully vaccinated? So that's kind of the vibe right now as it's an evolving process, and we're continuously monitoring the state of the pandemic. There's parts of the world that are experiencing variants and surges, and there's plenty of people who've tested positive after getting vaccinated as well. So we're thinking through where is testing headed. We don't think it's going to evaporate.
Right.
It certainly won't be at the levels it was last March. So where is that? How do we plan our business for that equilibrium?
I see. That's tough. What is the what do you think the outlook is that COVID sticks around at a much lower level and you kind of hear about it here and there? Do you have any like extra insight from your own data?
I wish I could tell you. I wish I can tell you. But it's hard. I don't think anybody has that crystal ball. So much of it depends on variants, how long the current vaccines will last until you need a booster.
Right.
I think some of that data is still not clear. These are such new therapies. Not everybody is choosing to get the vaccine for different reasons. So not all pediatric populations have been approved for the vaccine. There's different vaccine efficacies. So I think there's so many different variables that are at play here. So it's very hard to sort of predict ultimately what's going to happen. Right. But it seems pretty clear that it's not the virus isn't going away. But it is nice to see that we're able to relax just in society all the protocols. I go to a gym, and today was the first day that folks in the gym didn't have to wear masks indoors, and that makes it
Wow.
your day-to-day life experience a little bit better, because it was tough. Like it's hard to work out while wearing a mask, etc.
Yes, it is. I know.
So it's hard to have that crystal ball, but you just have to be ready to pivot on an ongoing basis. And right. I think now we've been tried and tested and are confident in our ability to pivot.
Wow. I feel like you're, well, I know that you're a real professional in this field. It seemed like you really have a handle on the whole thing, like every piece of this. When you got there in the middle of the pandemic, what was the state? What was it like, the Optum organization? Did you slip right in and keep moving in their direction? Did you change direction? Like what did you have to deal with the first month you got there?
Yeah, I would say when I first started at Optum Tri-State, there were some of the challenges were making sure there was so much inbound demand for testing from whether it's school districts or businesses or movie studios or wedding venues, and how do we figure out how we can accommodate the needs both at our urgent cares as well as the needs in the community. We were dealing with turnaround times for different types of, like, how do we meet that 24-hour turnaround time to get people results, or less than 24 hours in a reasonable amount of time to meet sort of consumer expectations. We also had to deal with all types of supply chain issues as we were launching rapid testing. How do we make sure that we are appropriately able to deploy supplies to all 60 of our urgent cares? And that's hard because you might run out of supplies at one location, and you have to move supplies from one location to another, and you have to educate the providers and the staff on the different types of tests available, whether they be the PCR, the rapids, the rapid antigen, the rapid molecular test. And how do you, it's not just teaching the clinical aspect, it's how do you use the tests and run the tests and report the test to the state. Those were all some of the challenges we were dealing with. And then even on other aspects, on the surgical care side, how do we make sure that all the patients that are getting surgery get tested in the appropriate time frame in advance and have the results in the appropriate time frame? If they don't have the results, what do you do? So those were all sort of things that we were wrestling with when we got started. I definitely talked to a lot of superintendents of schools trying to help figure out what are we to do? How do we open up in the fall? And what can we do to facilitate that? I talked to a lot of teachers unions and teachers associations, parent associations. It was my cell phone did not stop ringing.
So that would be like you guys would go in there and help test to open a school?
So yeah, it varies. In some situations, we've gone on site places and to help with testing. In some situations, we've set up drive-throughs at locations to help youth organizations like camps get back to get tested before the camps. In some situations, we just educated folks about our hours of operation, where we're available, where we have extended hours, expanded hours, and we launched reservation platforms as well, so that you don't have to wait in exorbitant lines. That you could we call it load balancing, so that at certain times of the day, you might have exorbitant lines, but if you have some reservations per hour, it'll help balance the load and reduce wait times and kind of help everybody involved. So we deployed reservation systems online. So those were some of the things we did as we worked with school districts and other organizations.
Wow. Amazing. There's so many pieces to your business. Do you guys, because you have 60 locations, do you also have, you must have your own lab for the testing?
So we do have our in-house lab that we use for some testing, but we also use the major labs as well, the major national labs as well for a variety of reasons, and they've been great partners to us, and we're really grateful for their partnership.
Awesome. And then for your image, like if a patient needs imaging, I imagine you have all those machines. Maybe not at every location. You have centralized locations or something like that?
Yeah, we have radiology at our urgent cares for X-ray. We also have imaging sites throughout our network for advanced imaging, MRIs, CTs, etc. So those are all part of our footprint. What we're trying to do is basically create a tri-state health system whose incentive is to keep people healthy, and we don't have hospital beds, and if we need to admit to the hospital, we will admit to the hospital, and we've partnered well with hospitals, but all our incentives are to keep folks healthy and out of the hospital, and using ambulatory settings that tend to be low cost and high quality in terms of outcomes, whether it be imaging outside of the hospital, or surgery outside of the hospital setting in these ambulatory centers, or using the urgent care instead of the emergency room. So that's kind of what we're trying to accomplish at Optum Tri-State.
Got it. So looking forward, what does the next 12 months look like? Next 18 months? What's your plans?
Variety of plans. One of the major initiatives we have in place is we're looking to get on a common EMR. Our organization has hundreds of locations, and not all of them are on the same EMR. So we're planning to get on a unified EMR, and that's going to help coordinate care. So if you get urgent care, if you get imaging, if you get your lab work, and you go to the physician's office, it's all going to be on one record, and that interoperability is going to be tremendous in terms of creating a non-fragmented patient experience.
Sure.
We're launching also what we call these big box medical clinics, where you can all get your holistic care under one roof. So let's say you might have back pain, you can get your imaging, you can see a neurologist, you can see a pain doctor, all in one setting, rather than go to numerous different locations and have a fragmented patient experience. So those are sort of major plans we have in the works. It's quite exciting.
It's funny because as you grow into this big box idea, which I totally understand, does it start to look more and more like a hospital? It's a good
question. Yeah, it's a good question. I would say there's a few distinctions and a few differences. It's not a big box. I would say these tend to be more in community settings, closer so that they're accessible to the consumer, and you don't have hospital beds, so you're in and out. So you might have an urgent care center, you might have imaging and lab, but it's more, you can get in and out pretty quickly, and you have that more of that retail experience. That's kind of how I would describe it.
It makes a lot of sense, right? Because hospitals are generally these huge real estate plays and the super high overhead, and of course they've got beds, and they are for hundreds and hundreds of people on the the corner of town or something. But you guys want to be embedded into communities in smaller spaces that you can lease easily and provide care right from there.
Yeah, that's exactly correct. The idea is how do you provide access and convenience to patients in a way that they have tremendous satisfaction, and you get them healthy, and you enable them to have very satisfied lives, and they want to come back to you for their care, and it's you develop a long-term relationship. So that's our goal.
Okay, I'll end with this question, and I don't understand the industry nearly as well as you do. But when I was growing up, you had your specialty doctors, and then you had the hospital at the edge of town.
Yeah.
Right? And then at some point in my early adulthood, I started hearing about these urgent cares, mostly in New York City. It'd be like this place you can go. It's not affiliated with a hospital, and you can go there and you can get a bunch of stuff done if you need to. It's open 24 hours or whatever. That was the first time I remember hearing about urgent care. Would I just become aware of it, or is it actually a new thing as of the last 20 years, 15 years?
Yeah, I would agree that the not just urgent care, but ambulatory surgical centers, a lot of these new modes of healthcare delivery have grown exponentially over the past 20 years. And you have more and more urgent care chains that companies that are specialized in doing this really well, and it's a new paradigm of care that it's this whole on-demand care that you don't need an appointment for, but you don't necessarily have to go to an ED, and you're creating access on the weekends and late at night where you didn't historically have that access, and that's what it's about. So it is something that is new, and the landscape is going to continue to evolve. Now we have telehealth, 5G technologies are down the pike, and we're trying to also make sure that at our organization we try to make sure that we don't treat the patient experience as just your episodic urgent care visit. If you need follow up, we have the appropriate specialist we'll link you up to. We'll make sure you have that appointment. If you don't have a primary care doctor, but we identify in the urgent care that you have chronic disease or hypertension, we're going to try to make that primary care relationship happen for you so that you can be healthy and being taken care of over the long term. So we're trying to make the care experience truly integrated. That's how I would think about it, Andrew.
Wow, that's amazing. Thank you so much for your time today. This has been a great conversation.
Oh, thank you. This was a pleasure, Andrew.
I really appreciate hearing everything that Optum's doing and that you're doing as well. It's just like, it's a lot of moving pieces.
Yeah, it is. But it's been truly rewarding and fulfilling.
Awesome. Well, thank you again for being on the podcast.
Of course.